Good morning. Thank you guys all for being here. This is a really amazing group of folks who represent and fight for seniors and people with disabilities and all New Yorkers. I'm New York City Comptroller Brad Lander. I am just coming from a forum that was at the Roosevelt House on the Upper East Side, and it turns out by coincidence that the Roosevelt House is where Social Security was invented. Francis Perkins, so that was the home of Franklin and Eleanor Roosevelt in New York City, and after he was elected president, that was where they were working on transition. And he invited Frances Perkins to come and wanted her to be the Secretary of Labor, first woman cabinet secretary. And she said yes, but she had some conditions. She said that she wanted to be able to pass a National Labor Relations Act protecting the rights of workers to organize, and that she wanted to create old age pensions. And that was the birth of Social Security. At the time, about half of older Americans were living in poverty. And as the Great Depression hit, that number was growing even larger, and those who were, literally couldn't get enough food to eat. And what an extraordinary difference Social Security made then and has continued to make across the decade, eliminating, combating poverty and reducing it for literally at this point hundreds of millions of Americans. And yet here we are with Donald Trump and Elon Musk wrecking Social Security, which now 1.3 million New Yorkers rely on, older New Yorkers with disabilities, and threatening to throw many of them off it by firing or eliminating the staff of the Social Security Administration that processed the program, by closing local offices, by eliminating the language access requirements so people who speak languages other than English can't apply or change their status, and by shifting it so that it is much more difficult to apply, to get direct deposit. There is a very real risk that hundreds of thousands of New Yorkers and millions of Americans will see their benefits diminished or eliminated or be denied benefits that they are eligible for. Or in one hideous policy change that they've made, in the past when Social Security was overpaying you, which of course is on Social Security in many cases, on the federal government, not on you, give you a way of paying it back that didn't eliminate your benefits, and now they are structuring so that even if they overpaid you, they will immediately eliminate your benefits, regardless of what that does to your ability to pay for your housing, to pay for your food, to pay for your daily necessities. Donald Trump and co-president Elon Musk couldn't care less about the well-being of our seniors, of people with disabilities, of families who rely on Social Security. Now, we've known already, because they put in Project 2025 their intention to shred the social safety net, including Social Security, but you would have thought that New York City at least would stand up for New Yorkers who are on Social Security and say, we're going to do everything that we possibly can to protect people and to make sure that they continue to receive their benefits. And part of why you would expect that is because we have this extraordinary network of advocates who are standing behind me, who have been helping to enroll people, providing information, helping people know what their rights are, doing the outreach that makes this a tremendous place to be an older adult, to be a person with disabilities. New York has so much to offer people, this rich cultural life, so many different people from all around the world. It's not always the easiest place to get around, but it offers so many resources. And so you're going to hear from a few of them in a minute, but I just want to say how grateful I am to be standing here with this set of advocates from Project Guardianship, Live On New York, Jews for Racial and Economic Justice and Caring Majority, Self-Help, City Meals on Wheels, the Center for the Independence of the Disabled in New York, Sydney, the Brooklyn Center for the Independence of Disabled, and the Jewish Association Serving the Aging, or JASA. They're just a few of the groups, but they are some of the toughest and hardest working advocates. And we really have transformed this, Social Security, plus this incredible city we live in, plus this network of organizations make this an extraordinary place to grow older, an extraordinary place to connect to and access services. And I'll tell one story about that in just a minute. Unfortunately, City Hall under Mayor Eric Adams is failing to stand up and fight for the New Yorkers who rely on Social Security. As in so many cases right now, it seems like he works for Donald Trump and not for New Yorkers, and that needs to change. And we're here today to call on City Hall and city agencies to step up and protect New Yorkers so they don't get thrown off Social Security or risk having their benefits lost or diminished. We can't let bureaucratic barriers, language inequities, or digital divides deny New Yorkers the benefits that they rely on every day and the benefits they deserve. So we're calling on Mayor Adams and City Hall to immediately deploy staff of the Public Engagement Unit, or the PEU, to start conducting outreach to people who will be impacted by these hideous policy changes, to deploy navigators at senior centers, NYCHA campuses, and libraries to start letting people know what's happening, take away fear where people just need to understand the information, and then help people figure out what they need to do to respond. We have opportunities also to leverage the Mayor's Office of Immigrant Affairs, the Mayor's Office of People with Disabilities, the city's Department of Veterans Services, and the Office of Technology and Innovation to do a few things. First, let's make 311 a vehicle for helping people get clear information about what's actually taking place, and launch a public ad campaign so people can call and get referred by 311 to someone who can give them the clear and basic information they need in the language they need it. And then working together with Department for the Aging and those other agencies, we need to stand up a capacity for people. So one thing that's happening is because they're shutting down local offices and laying off staff, they're forcing people to do more and more online and making it more difficult to do so, adding two-factor authentication and other digital barriers, and especially for seniors who may not be, some of them are experts in using technology and can teach me how to use the system, but some have less familiarity, and obviously people who speak languages other than English, even more so. We need to stand up a capacity that would be available in our senior centers and in our libraries and in senior housing that supports people to use the digital tools that they need and supports them to apply, to make changes in their status, and to make sure they're keeping their benefits, with an aggressive public education campaign, making sure it's in all the languages that New Yorkers speak and deserve access to, and providing digital tools, support, and resources. New York City could be helping hundreds of thousands of New Yorkers understand the changes and make sure they're doing everything they can to keep their benefits. Finally, we have one more recommendation, which is that Mayor Adams should instruct the law department to explore legal challenges to the wreckage that Donald Trump and Elon Musk are causing to Social Security. Others are stepping up right now to bring those challenges, including the American Association of People with Disabilities, who last Wednesday, April 2nd, brought a lawsuit against DOJ and the Trump administration for their attacks on Social Security and Medicare. And New York City should be part of that, should be filing an amicus brief or bringing our own lawsuit. And what I want to kind of end on that point with is this. The person I'm going to introduce next is Dr. Sharon McLennan-Weir from Sydney, the Center for the Independence of the Disabled in New York. And on Saturday, we marched together along with about 100,000 other New Yorkers down Fifth Avenue from the New York Public Library to Madison Square Park. And it happens that Madison Square Park is a place where Dr. Sharon and some of the other advocates up here and I have been before, because it's also the location for New York City's Disability Pride Parade, and I want to give a big shout out to Nick Astor, who leads our work in this office, including our co-sponsorship of that parade this year. Part of the reason the parade is at that location is that in the 1930s, in addition to the birth of Social Security happening in New York City, the modern disability rights movement was born in New York City in Madison Square Park, because that's where there was a WPA office. At the time, though, the New Deal jobs of the Works Progress Administration were not accessible to people with disabilities. And so a set of people with disabilities showed up outside the office of the WPA in Madison Square Park and engaged in a hunger strike until the Roosevelt administration opened up first hundreds and then thousands of jobs for Americans across the country for people with disabilities. And that reminded Americans that when we're making benefits available, when we're creating job and work opportunities, we have to do it for everyone. And we've tried to follow that in this office, in partnering with the organizations who are here, in doing some research on what it looks like to open up jobs access to people with disabilities, and in fighting alongside New Yorkers for their rights. That is the tradition of New York City that we are proud of, the one that created Social Security, the one that birthed the modern disability rights movement, the one that won jobs for people who needed them. And what New York City should be doing right now is standing up and fighting alongside people with disabilities, alongside older adults, alongside immigrants, alongside the folks who were out on Fifth Avenue on Saturday, because that's what New York does. We stand up for each other. We stand up for each other's rights and opportunities. We are not a city where the mayor bends the knee to cruelty or bends the knee to authoritarianism or bends the knee to the destruction of the Social Security and the safety net that it has taken generations to build. And that's why I am proud to be standing here this morning saying, let's get those outreach programs going. Let's get that lawsuit in place. This is an issue of justice, of civil rights, of opportunities for all New Yorkers, and that's why all New Yorkers need to be standing up. Thank you to everyone who's come out this morning, and now we're going to hear from a few of these fantastic advocates who are here with us this morning, starting with my friend Dr. Sharon McLennan-Weir. Thank you.
Good morning, everyone. Thank you, Mr. Lander, for allowing me to speak on behalf of people with disabilities. I do not speak for the whole community. I speak for all people. And the reason I say that is because people with disabilities, at any point, you who do not have a disability can become disabled. The beauty of the community is that it does not discriminate. You could be black or white, you could be rich or poor, you could be a Republican, a Democrat, or an independent. You could be gay or straight, you could be young or old. You could be poor or rich. The idea is that wouldn't you want to have access to help and services if you one day became disabled? Social Security is a lifeline for all people, but especially for those that have disabilities and those who are seniors. Keep in mind that many people with disabilities do work. The assumption is that we do not work and we're just taking, and that is not the truth. We have many New Yorkers with disabilities that have worked. We have seniors who have worked, and their Social Security benefit is their retirement, is their ability to take care of themselves, where they could pay for their rent, pay for food, pay for other necessities so that they can live. The idea that a senior has to worry about if their payments are going to be coming in month to month is traumatizing. Sydney is receiving many, many calls each and every day with our stakeholders worried about will they be able to pay their rent, how are they going to eat. Some people need life-saving medication that they're worried they won't be able to pay for, and the list goes on. We are here to advocate that Social Security stays in place. This is not money that people are, I should say, this is money that people paid into over the time of their life. So this is their money. We're basically taking their money from them. It makes really no sense. So keep in mind, as a disabled person, if you worked, you paid into Social Security, and if something happens and you get a disability, you're entitled to SSDI. So that is money that you've paid. Instead of getting it when you turn that certain age, you get it earlier because you acquired a disability. We have many, many New Yorkers who are in that situation. And of course, we have people who have disabilities at a young age, and because of the extent of their disability, they cannot work and they get SSI. So it's important to understand that we all need a lifeline. We cannot have a society where the poor is left to the side to die and not be served. So this is why Social Security is so important. And the last thing I want to say is all about assistive technology. It's important that, yes, we have some seniors who do not know how to use knows how to use technology, but we also have a lot of different learners. Myself, I'm a blind person. I use screen reading technology. There are people that use magnification. We have people that have learning disabilities. So accessing the computer is different based on the learner. So this is why some people rather call so that they can have their needs met because they can't navigate the system. It's not because they can't use a computer, it's because they may not have the assistive technology to help them, which is an additional cost. So please, let's make this an accessible society so that we can all benefit, and we need everyone to make a difference. Thank you so much.
All right, thank you, Dr. Sharon. Next up, one of our city's great senior serving organizations, Jeanette Estima from City Meals on Wheels.
Hi, I'm Jeanette Estima with City Meals on Wheels, and I'm here with Comptroller Lander and our fellow advocates because any attack on Social Security or HHS will make it more difficult and at times impossible for older adults to access the benefits that they need to survive. There are over 1.8 million older adults in the city. That's more than the number of school-aged children. So this is a major issue whose impact will be felt across the city. I cannot stress enough that for hundreds of thousands of older New Yorkers, programs like Social Security, home-delivered meals are a lifeline. Over 65% of our meal recipients are living on $15,000 a year or less. They are largely homebound with very limited ability to travel to a Social Security office, and over half are not online and use the phone to handle most things. Consider the impossible choices you would have to make in these circumstances. You would be constantly pitting your needs, your basic needs, for food, housing, and healthcare against each other. Not being able to set up your direct deposit on the phone, or not receiving your Social Security check that month because of an error in overpayment that was beyond your control would be devastating. Older New Yorkers need more services and better access to programs, not less. We cannot allow people to be blocked out of the benefits that they have spent their entire lives contributing to and that now help them to live with dignity. Thanks.
Right, thank you. Thanks, Jeanette. Now we'll hear from Evan Yankee from the Brooklyn Center for the Independence of the Disabled.
Good morning. My name is Evan Yankee, and I am the Advocacy Director for Brooklyn Center for the Independence of the Disabled, an independent living center based in Brooklyn. Part of our work is supporting people with disabilities and others in accessing their benefits to live in the community. We know from working day in and day out with people struggling to access benefits that the Trump administration's absurd cuts will force people with disabilities to wait for hours on the phone, make unnecessary trips to understaffed offices, and arbitrarily lose benefits they've rightfully earned by paying into Social Security for decades. The impact of these changes will quickly force hardworking people out of their communities and back into costly and abusive institutional settings, hospitals, homeless shelters, and nursing homes. People with disabilities value work, independence, and self-sufficiency, and the barriers to achieving these values grow higher and higher with these counterproductive cuts. We deserve transparency, just rules, and common sense, and these changes are the opposite of that. Thank you.
Thank you. All right, now we're going to hear from two people that I have had the privilege of working with both of them for a very long time, and they are two of the fiercest both fighters for and builders of organizations and coalitions that fight for older New Yorkers and all New Yorkers. And they're also just inspiring in their, I met each of them when they were running a previous organization. Actually, I think I met Bobby 2 organizations ago. When she was already a leader for older adults at the Coalition for Senior Centers where were you before Live On? Council of Senior Citizens, out of which that emerged into Live On. And you're going to hear to close us out from Allison Nickerson, who is now the ED of Live On. But it's my pleasure first to introduce Bobby Sackman, who is now with Juice for Racial and Economic Justice and the Carrying Majority. Bobby, thank you.
Can I take that out?
Absolutely.
I don't do podiums. All right, thank you. Hi, my name is Bobby Sackman. I'm here representing today Juice for Racial and Economic Justice and Caring Majority Rising. And yes, I worked at Live On New York for many years. I'm pissed. I mean, I can say this, right? I'm retired, I guess. I could say anything. I am really pissed. I feel betrayed by our federal government, but I also feel betrayed by those who represent us federally, and as the comptroller is saying here in New York City. Nobody I can see is really standing up for us. And this is desperate, as you hear, and I don't even think it's a long stretch. We all know what Social Security is. No matter what age you are, you probably have parents or grandparents or other relatives that are on Social Security. So the poverty level is about $15,000, but there are millions of people that get, in New York City, thousands of people that get $16,000. So do the math; they're barely above the poverty level already. I like this kind of math stuff. 1.3 million people are getting Social Security in New York City. That's bigger than the state of not Pennsylvania. I am so sorry. That's bigger than the state of Rhode Island. It's bigger, not all together, each one. It's of 8 states. I don't know all of them. But Rhode Island, it's bigger than the state of Alaska. It's bigger than the state of Vermont, Montana, and the list goes on. And that's just people on Social Security here in New York City, who do speak many languages. There's increasing poverty. There was a recent report that the Center for an Urban Future put out in 2024 with AARP about how across New York State, older adult poverty has increased by 50%, 50, while overall, and this is statewide, poverty went down by 22%. But in New York City, closer to home, 1 out of 4 older adults in New York City in the Bronx live in poverty. 1 out of 5 in Brooklyn live in poverty. 15% in Queens. And it goes on. And 1 out of 5, almost, it's hovering around 1 out of 5 all together across the city are older adults who live in poverty. And I think this poverty is really invisible. I think when you talk to people who are in the social service world, even in the activist world, and you start to talk about older adults in poverty, they look at you like they've never heard of this. And they almost don't believe you. Because somehow we're getting Social Security, we're getting Medicare. Obviously, many are getting Medicaid because they're in poverty. But there is this belief that somehow we're doing okay. We're not doing okay, and we're going to do worse. So I do agree with you that we need the city to step up. I really come out of the system of 28 years of talking about Meals on Wheels and congregate lunches at senior centers, and we're going to lose millions of meals and millions of dollars in this city. The city has one piece of proud history that we've never had a waiting list for Meals on Wheels in this city. We don't give the agencies enough money to cover the cost. That's a whole other budget issue. I cannot not say that. But we've never had a waiting list. Where around the state, they do have waiting lists. I don't know how they live with themselves, but they have waiting lists for Meals on Wheels. We don't. So we demand, and we have to see Mayor Adams and, of course, City Council put in whatever is lost for the lunches and all the other services under the Older Americans Act have to be fully funded. And I know there's also cuts that the mayor's already put in. This is, I don't even know what to call them, the Doge guys are closing the Administration on Community Living, ACL. It's a small agency. Most folks have probably never heard of it, but it serves thousands of people, not just in this city, but across the nation. So I'll finish, and with people with disabilities. I'm so sorry. I'm so sorry I didn't say that up front. And so I'm just going to close with this. Take our income away, take our food away, and even worse, and our health care away as well. And I just think they're going to pay for it. And I tell you one thing, I was there on Saturday in the streets. There were a lot of gray-haired people in those streets on Saturday, and we're not done rising up. Thank you.
All right. Thank you, Bobby. It sounds like you can take your income away and her food away, but no one's taking her voice away. So thank you, Bobby, for being out here and expressing how pissed off we are. I mean, this level of just cruelty is disgusting, and it's important for people, even as we're fighting, just to be morally clear that throwing seniors off their meal programs and the benefits that pay for the lives every day is just disgusting. So thank you. The other person I've had such a great long opportunity to work with is Judy Willig, who now is with Project Guardianship and for over 30 years led Heights and Hills, one of the, just this wonderful network of senior serving organizations that make the lives of seniors in our neighborhoods not just that you get food and some income, but that they could be beautiful because they're in community and supported. And Judy, we're lucky to have you. Thank you.
Thank you, Comptroller Lander. It's great to be here. Good morning. I'm Judy Willig. I'm a geriatric social worker, and I've spent my entire 45-year career working with older adults, but I started working in the disabled community. I'm here today not only as a representative, I'm on the board of Project Guardianship, which is an organization that works with the most hidden people. These are people who have been determined by the courts to need someone else to take over the management of their affairs. Most of the clients are either older adults or people living with mental illness. And they can no longer manage on their own. And most of them are without family supports or support networks. These are people who are isolated, often at risk, and entirely dependent on the safety nets that have been in place for the past 60 years, or in the case of Social Security, 90 years, that we must protect today. Social Security and Medicaid are not luxuries, they're lifelines. Cuts to these programs will be devastating. And here in New York, we're already in crisis. Our guardianship system is overwhelmed. Judges across the state struggle to find anyone to step in as a guardian in nearly a third of all cases. Now imagine adding the loss of Social Security and Medicaid benefits to that picture. Guardians already fight to secure basic needs for the people in their care: housing, food, medical treatment, end-of-life care. If these federal cuts go through, their jobs will become nearly impossible. And it's not the policymakers who will pay the price, it's the older and disabled New Yorkers who will. These cuts aren't just numbers in a budget. They are a direct threat to human lives and dignity. We urge our leaders to reject this reckless, inhumane proposal and fight for a system that protects everyone, not just the privileged few. Thank you.
Right. Thank you, Judy. And last but most certainly not least is the organization that does really the most of all to fight for the organizations that serve older adults in New York City, whether they're the meals programs or the senior centers or the organizations that support seniors in our communities. So to close us out is Allison Nickerson from Live On New York.
Thank you. And thank you, Comptroller Lander, and the whole team here for having this important press conference. So I'm going to make this very short and sweet. I'm Allison. I am the Executive Director of Live On. We support the community-based service system in the city and state that supports older adults. The federal government is directly attacking the people of this city by not allowing people to access the services that all of the folks here talked about today. The ACL, the Administration for Community Living, has been disbanded. 44% of their staff have been fired. The LIHEAP program, which allows people to pay for electricity so that they don't have to go through heat stroke in the summer, has been completely disbanded and their staff have been fired. Medicare, Medicaid, Social Security, Section 8 project vouchers, which underwrite our affordable senior housing in the city, all of those are under threat. This cannot stand, and this cannot stand because for a million reasons, I could go on and on, but this cannot stand because we are Americans and we believe in things like block parties and standing in line and making sure things work. And we have to band together to make sure that all citizens have access to things that they need. Here's what we're doing. We're calling upon the mayor in this time to do 3 specific things. Number 1, immediately rescind the $100 million cut to NYC Aging. The fact that the city is willing to close 90 older adult centers, which represent thousands and thousands of meals, is absolutely abhorrent. So we call on the mayor to immediately rescind that. Number 2, provide additional funds where needed. We love the proposals that Comptroller Lander has suggested, including the public engagement unit. We need to give more people access to the things that are being taken away from them, because at the end of the day, this is not only their livelihood, but this is money in our communities, and this is how we support each other. And the third is we need a comprehensive, detailed plan on how this city is going to support and protect its oldest residents and people who are living with disabilities. So I thank everybody for being here today, and more to come on these insane cuts.
Thank you, Allison. And when Allison says there's a million reasons why we're not going to let this stand, she's not speaking in any exaggerated way. We're talking about over 1 million New Yorkers who rely on Social Security, and every one of them is a reason. Every one of them is someone who is able to see their grandkids. Every one of them is somebody who's able to lead a rich life. Every one of them is somebody to get the nourishment that they need to engage in community. That is what we're talking about here. The numbers are big, but the impacts on people's lives are even bigger. And that's why we're just getting started. We're going to be fighting back along with people all around the country against these cuts. Obviously, seniors in red states also know that what we're saying is true, and we believe it'll be possible to build a national movement as part of the city budget fight. As you heard, there's a clear opportunity for New York City to show up for New Yorkers, reverse those $100 million in cuts, expand and provide more services, and we're calling on Eric Adams to step up and do everything that the city can to make sure that New Yorkers who rely on it do not lose their Social Security benefits. Thank you guys all for the work you do every day and for being here this morning. Thank you. Thank you.